Dr. Harshvardhan ji, Preeti Sudan, Rita Teotia, Pavan Agarwal ji, and friends from the media. You are the most important partners for us today. This is something which is very close to WHO's heart, Eat Right. And I congratulate the Government of India, congratulate the Department of Health, so ably led by Dr. Harshvardhan, who has thought of something which WHO has been talking about for a long time, but sees it today in practice, that one of the member states of the region has been able to take it forward in a big way. When we look at mortality worldwide and also in India, I would like to repeat what the Honorable Minister just said, that there is a shift of mortality from communicable diseases to non-communicable diseases, which means that more people today are dying from cancer, from diabetes, from heart diseases, from respiratory diseases. And this is not something which is only confined to India. This is the worldwide trend today. We find this happening in all countries of the world. There is a shift now that is happening. For India, of course, there's a double burden. We are looking both at communicable diseases and non-communicable diseases, and we find mortality from both, but much more from non-communicable diseases. In trying to address non-communicable diseases, WHO has identified 4 risk factors. And what are those? We are talking about healthy food, which is what this campaign is about, Eat Right. We are talking about physical exercise. There has to be movement, move for health, which in this regional meeting, we are again emphasizing. We meet every morning for some form of physical exercise, be it yoga, be it aerobics, be it a walk in a garden. Some form of physical exercise is being done. We also, during our meetings, have healthy breaks, which means we get up, do some stretching exercises. We are not sitting in a chair continuously for a very long time. This is something that we are pushing hard. We are also trying to propagate that tobacco use is something which should not be there, and India again is taking the lead there. They have been able to take steps which have now, according to the latest surveys that WHO is doing, shows that there is a decline in tobacco use, yet a lot has to be done if we want to achieve the SDG targets of 2030. And 4th is alcohol, which we find is again a big risk factor. Be it cancer, be it respiratory diseases, be it diabetes, alcohol also plays a very major role in this. And therefore, this is a message that everyone should get. And when we talk of Eat Right, WHO says you must have 5 servings of vegetables or fruits in a day. That is absolutely essential. WHO also has enough evidence to say that salt should be reduced in food. What we are talking about is half a spoon of salt in a whole day. That is what we need to emphasize. And our way of eating is such that we forget that we are having salt when we are having chutneys, we are having papads, we are having all kinds of food, where also we are taking salt. So it's not just salt which is being added from the top. It is salt in your food, it is salt that you eat every day. So that has to be reduced because it's linked with high blood pressure. Secondly, we say sugar. Sugar is something that is really, if we put it very bluntly, this is how we look at it. Beyond a certain point, acts like poison for the body. It is something that is highly avoidable. And therefore, that is another big message which our friends from the media can give, that salt intake, sugar intake has to be very restrictive. Trans fats, big movement all over the world, started in a big way in the US, and now it's really a movement, and I'm so happy to see that FSSAI is also taking it up under the leadership of the health minister. Trans fats are really bad for us. Therefore, this is a message that we need to give today. There is a message for those who consume food, that they have to make healthy choices. Very often, you know, something is not good for you, and yet you eat it. And there is also a message for those who manufacture food. And that is what this meeting is about. And you've seen that there is a push that there should be healthy food produced for people so that they have access to healthy choices as far as food is concerned. There are some countries of our region like Sri Lanka and Maldives who today have labels on liquid drinks. So there on beverages, they put a red label if it is very dangerous. They put a green label, which means it's fine, you can drink this. They put a yellow label where they say, you know, it could be harmful, so think about it when you consume more. So there are countries like that in the region which are already taking important steps. Some other countries like Thailand, if you go, you never find potato chips there. They will have other snacks. So these are the things where industry can help, where they can help in not manufacturing those kind of snacks which people will consume and will only get sick. So I very highly appreciate what India has launched, the Eat Right movement. It should really become a campaign, and it should be in mission mode. Everybody should talk about it, right from children to adults, to families, to communities. It's very important that this message goes, and most important is your role in it, because everybody likes to read what the media writes, and media can be very effective partners in this campaign.